whenever we educate our patients, what we want to do is make sure that they understand what we're trying to express. Chiropractic care requires that kind of explanation. We usually do that in a report of findings. That could be a one-on-one interaction, or it could be a group interaction. And when we show our patients an X-ray is well understood as a great tool for looking at the structural or the positional relationships of your spine, and then making a recommendation based on that is pretty obvious to the patient. They recognize that bones can affect nerves, and bones out of place can have an impact on nerve function. But we can also ask the question and use the Socratic method, get your patients to kind of come to the conclusion on their own. Does anybody here in this room know what bones are made of? And you might get some answers, right? So bones can be made of vitamin D and calcium, magnesium, and among other things. And then the question is, should your vitamin D status, your calcium status, or your magnesium status be something that we take for granted? Is it something that you're pretty sure is what it should be? Or should we look into it? Would you like your doctor to guess what these levels are, or should we test? Well, in order to have optimal experience here in this office with your chiropractic care, we choose to test. We find that testing gives us more information about how to get you the best and quickest results possible. And the same thing holds true not just of your bones, but also your nerves. In order for your nerves to communicate, they need certain nutrients. They need certain, they need the ability to make what we call neurotransmitters. The ability to communicate between the brain and the body requires nutrients like vitamin B9 or folate or vitamin B12, just to name a couple of simple ones. But again, let me ask you, how many in this room know what their current B12 levels are? Chances are nobody's going to raise their hand. And again, we ask the question, would you like us to guess what they are? Or would you like us to do a simple test to find out exactly what they are so we can give you what you need? And again, our organs and our muscles require proper nerve flow, but in order for that communication to take place, not only do you need those nutrients we discussed, you also need fuel, right? What is the fuel that the body uses? Oxygen and glucose. Well, what is the status of our ability to deliver oxygen, right? Oxygen is delivered by red blood cells. And how do we know the status of our red blood cell health? How many red blood cells do we have? What is the health of our existing red blood cells? We can guess, or we can test. Same thing with glucose, right? Again, the fuel that our body uses in order to communicate. That's tightly regulated. Very important that we don't have too much or too little glucose in the blood at any given time. Should we guess what your status is, or should we test? I agree with you. I think we should test. And again, when you come to a chiropractor's office and there's aches and pains, usually it could be chronic, it could be left side, right side, it could be the upper extremities, lower extremities, headaches. We always throw around the word inflammation. Well, what is the status of your inflammation? Are you checking those markers? Do you know what your current level of inflammation is? How much of your pain is due to a problem in a joint itself, or a problem with circulating inflammatory markers that we can measure on a blood test? Do you want us to guess what those things are, or should we test it? And again, I agree with you. Testing it gives us much more information and much more direction. We want your care here to give you the highest chance of getting well as quickly as possible. When your lab results are out of alignment, we call it a metabolic subluxation. Just like when your vertebrae are out of alignment, we call those vertebral subluxations. What do we need to do to correct the vertebral subluxation? We need to adjust the structure of your spine in order to remove that subluxation. Well, the same holds true for the metabolic subluxation. We need to adjust some nutrients. We need to adjust some lifestyle markers. And that adjustment usually is going to take place with certain nutrients that will be recommended for your patients to specifically correct their metabolic subluxations.